Good morning, happy Facebook, happy Friday. I'm so excited to be here. Sorry I was running a little behind. So today we're going to be doing Botox Live, talking a little bit with you guys about Botox Night and as well as Get Glam. So those are coming up in almost a week now. So we're getting really close to our big holiday event, and so I'm really excited to show you a little bit about, learn a little about Botox, what is Botox Night, and Get Glam. So I'm here today with our injector Michelle and Laura, and we're going to show you Botox, and you're going to learn a little bit about them. So here we go, Botox. Don't forget to ask questions. Make sure you comment them below, and we will try to answer them throughout the live video. All right, here we go. Hello, ladies.
Hello.
Good morning. Happy Friday.
Happy Friday.
I feel like I have my inner roar right now because I'm wearing cheetah today. You guys think that's funny? Okay.
It's funny. Nice.
Thank you, Laura. Thank you for that. All right, so today we're doing Botox, and this is Michelle. She's one of our injectors here.
Hello.
So I know that this is one of your first live videos. So tell the patients a little bit about yourself. You are a nurse. How long have you been a nurse?
I have been a nurse for 11 plus years.
Wow. And so where's your you have a very eclectic background, so you come from the OBG and aesthetics, correct?
Yes, I do.
Yep, so that's great. And so Michelle here does all of our Botox, but you also do other procedures. So what else do you do here?
I do dermal fillers, lasers, some vaginal rejuvenation.
Michelle. So yes, that is one thing Michelle does here, is she does mainly all of our Votiva vaginal rejuvenation. So, you know, you thought you were getting away from the OBGYN world.
Still here.
Okay, so today we're doing Botox, and this is one of Michelle's specialties here. So she does Botox. So explain a little to me about what is Botox.
Botox is FDA approved. It's a purified toxin that's injected into the muscle to paralyze or relax the muscle and prevent any movement or etched in lines.
Perfect. So we're going to go over to Laura here and explain to me a little bit, Michelle, like where would Botox go? Because one of the big things I've been getting a lot lately is like people want it like in their under eyes, and I'm like, where are people going? Like, so explain to me where Botox is actually placed.
So Botox is placed in the glabella area, which is this area here. If Laura makes a frown or bad face. So this muscle here is the procerus muscle, and these bulges are the corrugators. So if we inject in here, it relaxes these muscles to prevent the 11 lines.
Okay, and then also forehead, is that correct?
Yes, and then the forehead, if you raise your eyebrows. And then when you raise, the muscle lifts and it causes horizontal lines here. So we inject in the forehead to relax that muscle.
And then
also crow's feet, which those lines are caused from squinting, some wrinkles, smiling. So if you inject in the muscle around the eye, the orbicularis oculi, then that will help relax that muscle there.
Exactly. Perfect. So those are kind of the areas we do Botox in. And I know lately I've been having a lot of patients like say like they want Botox here. And I was like, I need to ask Michelle that.
So we don't Botox under the eye in the tear troughs. There's risks come along with that. It's not FDA approved. We can cause an eye droop, which it could be known as a fish eye.
So what would that look like? It would be like on down?
Yeah.
Open your eye, Laura. Yeah, that's a nice
so
look.
We don't want to cause that.
Okay, so what would be, what did Laura have to do prior for Botox coming in?
So prior to coming in, we usually no exercise for 24 hours before or after to prevent bruising. Limit the alcohol consumption, that helps limit your bruising. Anything to help with bruising. Over-the-counter meds like fish oil, Advil, Motrin, that helps.
So so really
bruising.
And how long does the actual procedure take?
About 15 minutes.
So it's really simple. So if someone wants to have this done on their lunchtime, that is definitely possible to do that with you.
Yes, there's no downtime. It's a great holiday. Gift to yourself.
I love that. All right, so let's go ahead and inject here, and she's gonna talk to you about how many units she uses, because I know that's like one of the number one questions I get on Botox is how many units am I gonna need? How many units? So you're definitely gonna go over that as well, and you're gonna inject Laura today. She is full movement. So let's go ahead and do that. So
I'm just gonna clean the area with alcohol. So if you come in with makeup, it's fine. Just know it we'll wipe it away.
That's a good point. So think that, ladies. So if you are going back to work or you have something to do, make sure maybe you bring a little foundation or bronzer or powder just to kind of touch up.
You can reapply it as soon as you're finished.
That's perfect. So how long does Botox last?
The average is 3 to 4 months, and it does take 2 to 14 days to kick in fully.
So that's something to think about. So I always talk about, I saw, since Christmas is coming, I saw that movie, Christmas with the Cranks. Have you guys seen that? And Tim Allen, he gets Botox done, and he had it done that day, and all of a sudden he can't eat, and he's like, I can't move my forehead, and I'm like, that is so unrealistic, and that's why I love doing this, because Botox doesn't kick in until 2 to 14 days, right. And don't worry, everyone, you can eat. That is not.
Yeah.
We're not going anywhere near those muscles or anywhere near your mouth. So
yeah, you just want to make sure you're in the upright position for the first 4 hours.
Oh, perfect. And one of our injectors actually just jumped on, and she also does it here, Jenny. So if you're interested ever, Jenny does it, as well as Julie, Dr. Downs, and Rochelle. So we have a lot of Botox injectors. Yeah. Okay, so we're going to get started here. So what are we doing first?
So the first injection is going to be right here in the procerus muscle. And in this area, typically the average is 20 to 25 units.
Hi, Jenny. Jenny says hi. You're doing great.
Hi, Jenny. Okay, and I have you frown. Okay. And this bulge here is the corrugator, so we'll inject that.
Okay, perfect.
5 units here.
So we've done, what, 10 units so far?
Yes.
Okay.
And then we jump up here and do the tail.
Perfect.
5 more units. And then we do the same on the other side.
So 15 so far, roughly.
So there is pinpoint bleeding, which is normal.
And you won't be able to see that after you're done with the injections.
No, these little spots here will go down in about 20 to 25 minutes. So we injected 25 units there.
Perfect. So just for the patients that know, so she just did her what's called the 11s, and she did 25 units. So if that's something you're interested in doing, just your 11s, it's roughly around 25 units.
Okay, now we'll jump to her forehead.
Okay.
So you're gonna raise your eyebrows, and so we'll inject up here to prevent these horizontal lines.
And we also inject up higher because of the drooping of the eyebrow.
Yes,
is that correct?
Correct.
Okay. Now, Laura, Tracy wants to know how bad it hurts.
There's a little bit of a sting initially, but it's not terrible.
Okay. So just the quick injection.
Yeah.
Mm-hmm. And usually, I will say this for you guys out there, Michelle is going a little slower than she would normally inject. That way she can teach you. Normally, this is very fast and quick. So you're doing a motion what's called an M, correct?
Yes.
And again, a little pinpoint bleeding, not too much, a couple bumps, and these will be gone in a couple minutes from the injection site. So how many units did you just do up here?
I just did 10 on her forehead.
So right now, you guys, we're at 35 units. So if you're looking at doing your 11s in your forehead, which is probably the most common areas that patients want injected, you're looking at around 35 to 40 units-ish, depending on how much movement you have. Even though Laura has full movement, she does not have a lot of lines in her forehead. So, I mean, she doesn't have to do as much. Correct? Because men are different too, right, Michelle? Men tend to have stronger muscles, so they tend to need more Botox. Okay, so now we're going to move to the crow's feet, correct?
Crow's feet here. So I'm going to inject here. Okay, I'm going to do 5 units here for the upper part.
So you did 5 and 5?
Yes.
Okay.
To help with that.
There's so many people watching me. I love.
So there's one side, and now we'll do this side.
Now again, I just want to point out again for you guys, this is not an immediate result. It does take roughly 2 to 14 days for this Botox to permeate into your muscle. So Laura's still going to have movement. Now, one thing I've always been told that the more you move during when you have Botox, the quicker it can be applied. And another thing, again, we're going to go over post instructions as well. We're going to hit that in a second. So we are completely done with her Botox. She is done injecting. How many units did we actually do?
We did 25 here in the glabella, 10 more on her forehead, 35, 10 on here, 55.
55. So
and 10 over here.
So we did 55 units with Laura. And that's it. So she's just kind of... Oh, Robin says you look young to be needing this. You'd be surprised. I was actually really surprised by your age, Laura.
It's good for the young and the old.
Yeah, so that's actually a great question, Robin. So one of the things about Botox is prevention. So if you're looking to prevent or anti-aging, this is probably the number one besides retinol that you could do for yourself is Botox to help with that anti-aging. Okay, so you want to go ahead and move for me? There you go. So that way we don't get the Christmas with the cranks. So again, she's still going to have movement for quite a few days, and it will come in. So I'm going to go zoom up one more time. These little bumps are going to be going away. You can already see that the ones that she injected first already have come down quite a bit. It's from the pinpoint. But again, super easy procedure, really quick. You did 55 units. So you guys, I'm really bad with math. I always tell you that. So how much is wondering about the price? Good question, Samantha. So our price is $13 a unit. Yes. So it'd be 13 times 55. So what is that, like $650? A little more than that. A little more than that. Just quietly over $650 because I can't do math. I'm a marketing people. But if you would do normally averages 50 units if you want all 3 areas. So again, I want to point out one last time, 25 units, 10 units, 10 and 10. Correct?
Yes.
So if you're looking for full correction, you're going to be 50 to 55 units. If you want more of just more your 11s and forehead, it's going to be a little less units. Now, any other post instructions? So what can Laura do? Can she go out to dinner tonight? What's going on?
Go out to dinner tonight. She can apply her makeup right away. She just wants to be sitting up in the upright position for the next couple hours just to make sure it stays in the muscle we put it in. And just light exercise or no exercise for the first 24 hours just to help with prevent bruising.
Okay, so other than that, she can sleep normal.
Yeah, and you will want to cleanse your face lightly tonight, maybe just with your fingers instead of a washcloth, but you can still use your product.
Yeah, so really simple procedure. Oh, thank you, Bridget. $7.15 for 55 units. She did the math for us. We really appreciate it. I always tell you guys that I'm not good with math on here.
Not either.
So again, super easy procedure. We're going to be doing this on Botox night. Again, let's just go over Michelle really quickly. I want to go over what is your favorite service and your favorite product at the Centerpiece. To know you a little more.
My favorite service is the Botox.
She loves that anti-aging.
Yeah. So
I thought you were going to say Votiva.
Well, I was labor and delivery, but I still like it. And then maybe my favorite products, it's going into winter, so I'm really liking the Center Yourself, the Dermal
Restore Cream?
Restore Cream.
Oh, that's one of my favorites too.
It helps with the cold and drying. It's a hydrogen that penetrates deep into the subepidermal layers. It's the smallest molecule in the world. It has antioxidants and it helps fight against free radicals, which the free radicals damage your skin, so the antioxidants help fight.
So if I get sun damage, if it's wind, smoke, anything you would do environmentally is going to help, definitely do that. I love the Dermal Restore Cream and it's perfect for winter. So again, this is Michelle. She's one of our full-time injectors here. For you guys, just so you know, she's been here for quite a while, and she's been a nurse for over 11 years. So she definitely knows her anatomy, that's for sure, you guys. And she does everything from Botox, dermal fillers, lasers, as well as our fun vaginal rejuvenation Votiva. So come on in, get your Botox with Michelle. She's going to be injecting Botox tonight, and we're going to talk about that a little bit. So again, one last look, 55 units with Laura. Really simple. Look at those bumps have already pretty much almost all the way gone already. She can just apply a little makeup and they're going to be gone. Again, pre, post, just avoid alcohol, avoid Advil. Just be sitting up for a couple hours. Don't be laying down, taking a nap after this. Pretty easy procedure, and it's done every 3 to 4 months, correct,
yes.
Michelle?
Yep, the average is 3 to 4 months. You want to come back before it's completely worn off to prevent those lines from
exactly. And I've also learned a little bit too about that is if you do come back prior a little bit, the less you have to inject into. So if someone's like full movement like Laura, we had to put more like 55 units. But if you come back right when your 3-month mark, you might have a little less, so you might not have to pay as much.
Correct.
How much do you do for lips? Oh, good question. So how much do you usually syringes? How many syringes do you do for lips? Just depending, 1 to 2 with Fobella?
Yeah. The average 1 to 2.
And you know what the price is for that by chance, Laura?
$400 per syringe.
Yep. Okay, so I don't know. So for lips, someone wanted to know, Janet. So it's $400 per syringe. Usually 1 to 2 syringes that Michelle can do that for you. She does everything, Voluma, all of that. So Jupiter, Sculptra, all of it. So just let her know. She can help. And she's not only our only injector. We have Jenny. She does injections as well. And then as well as Julie and Dr. Downs. And so Julie is great too. Julie is here Monday, Tuesday, Wednesdays. Jenny's here Tuesday, Wednesdays, and Michelle is here 5 days a week. So we can accommodate you all times. All right, so what you guys are for come back to me a little bit, my cheetah print. So Get Glam is coming up and Botox night. So again, Botox night, we are almost full. So make sure you guys give us a call. Call Laura, call Elizabeth. Get in there. We're going to be doing injections all night from 4 to 8. And we'll have all our injectors here to inject for you guys. So make sure you come in. You have to schedule an appointment though. Okay, so if you want actual Botox that night, you need to call and make it an appointment. However, we will be here that night for Botox night. We will have later in hours, so if you don't want your Botox and you just want to come out and check us out, talk to us about Botox, you're unsure about it, then just stop by as well. Going into Botox, we have Get Glam. So let's talk a little bit about Get Glam in general. All right, so our lovely Get Glam is coming up November 13th through the 17th. We're going to have specials on products and services here at the Center Yourself Medical Spa, and you get to always our favorite pick from our famous Christmas tree, and you never know what's in there. There's services usually in there, products, gift cards. So ladies, come on out. So if you come out to Get Glam and you purchase that product, you get to pull from our Christmas tree. It could be anything you purchase comes from our Christmas tree. And I will get your questions. I see a lot of questions coming up. I will get to them after I am done with my lovely soapbox spiel, okay? So you get to pull from our Christmas tree. We're gonna have awesome stocking stuffers this year. They're really brick. Some of them are brand new and you're gonna love them. I know you are, so I'm so excited to show them off for you guys. As well as our specials, but then on top of it, we will have giveaways. So make sure you come in just to even put your name in the raffle. We're going to have some light hors d'oeuvres, some champagne during the day. However, we will have more like coffee, some juices, some desserts. So if you come to Botox night, you will get the champagne and hors d'oeuvres. But if you come during the week, maybe Botox night, Wednesday night doesn't work for you on November 15th, then come during the week and see us. We're going to be here during our business hours. So quickly for you, fast wrap up. Product services will be on special from November 13th through the 17th. Come to our business hours. We're going to have some light refreshments and snacks for you. Look at our services, pull from the Christmas tree, check out the stocking stuffers. This is the perfect time. And then we have Botox night during that long week, which is November 15th. And that is from 4 to 8. And we're actually going to be injecting Botox. If you want the Botox done, you're going to have to call and need an appointment for that. However, we will be seeing patients every 15 minutes for Botox, but you will need an appointment for Botox night. It will be a special rate. So regarding the rate for Botox night will be $11 a unit, and you must purchase at least 50 units. Now, that does not mean that Michelle may only inject 45 units. Well, then that extra 5 units will roll over on your account, or vice versa. If you get 55 units like Laura today, you must purchase and pay for the 55 units, not 50. So it's a minimum 50 units that night, $11. But with Botox in general, if you purchase more, the savings. And if you purchase 100 units or more, let me show you what you're gonna get. So you purchase 100 units or more for Botox, you get this beautiful bag, designed by yours truly. This beautiful bag, as well as a Skin Better Science product, okay? So it's a gift with purchase over 100 units. So think about that, you guys. Again, right here, 100 units or more, you get this bag and this product. And that's gonna be for Botox night, and it's actually gonna be for the whole week. So if you're thinking about coming in, this is while supplies last. So just keep that in mind, ladies. If you want your free product and bag, might want to call us early in the week. Just saying. You never know. Okay? So again, Botox night November 15th. Call us, get your appointment, because we are almost full. And the Get Glam week is November 13th through the 17th. Now, your questions, Irina. Where is it at? So the actual Get Glam and Botox night is at our location, 611 East Douglas, the Center PC. So make sure you come. We posted our business hours up for you guys during Get Glam. And do you guys do consultations? Yes, we do, Janet. We do consultations. We do them during our business hours all the time. You can see Michelle, Julie, Jenny, Tiana, Courtney, Melissa, Kat, Brandy. We have a lot of providers here that you can see for consultations. So I think that's it for you guys. Come on out, Get Glam November 13th through the 17th, and Botox night November 15th, and make sure you're looking minimum 50 units. We're almost full, so give us a call today to get in, as well as if you purchase 100 units or more, you get these fun items. So think about it, ladies, as well as make sure you think about Get Glam the whole week. Get to pull from our Christmas tree. All right, that's it. I'm going to turn the camera over to you and say bye. Bye, guys. Make sure you guys, yes, happy Thanksgiving, and make sure you guys one more look at Miss Laura and her Botox. She just loves getting me all close up. Love it, love it. Look at that. Like, her bumps are pretty much gone now.
Pretty much gone.
Yeah, and she's still moving so that she's in that Christmas with the Cranks. And Robin, yes, we're in Mishawaka. We are near like Chick-fil-A, Drive and Shine. We're actually in the medical office building of the St. Joe Hospital. So think about that. So Get Glam November 13th, Botox night November 15th. Give us a call, 574-968-3510, or visit our website, thecenterpc.com. We hope you guys have a great weekend. Go Irish, and we'll be back next Friday. Bye, guys.